welcome to this video for the International Youth Dancer Health Alliance. We're having a awareness week about mobility and flexibility, and today we're going to talk about plié depth or dorsiflexion range of motion. My name's Dan. This is
Steffi.
Welcome, Steffi. Thank you very much for doing this. And she's going to help me out showing how we measure dorsiflexion range and what we can possibly do about it. We think this is important, in part because it seems to be playing a role in overuse injuries. A deep plié can help a little bit with that. We also know that in technique, it's easier to keep your heels down if your plié is a little bit deeper. And also for performance, some people might say you can jump higher if your plié is a little bit deeper. So there's enough reasons to aim for a good plié. So Steffi doesn't have any problems with her plié, but for the purpose of today, we're going to sort of pretend she does. And we're going to do that doing a very simple test. This is called the knee-to-wall test, and we have a measurement tape on the floor here, and we're going to do this in centimeters. I'm going to ask Steffi to come close to the wall, try to touch her knee against the wall, keep her heel on the floor, and see how far can I get away from the wall, touch the wall, but still keep my heel on the floor. So let's start that with whatever foot you want to start with.
This one's fine.
Good, let's start right in the middle. And you go forward. And you come back. And you try to go back a little bit further because that was easy. Same thing here. Feels okay?
Yeah.
Good. Could you go a little bit further? Alright. Do you think this is about your maximum?
Kind of.
Good. So we see good range there. And the other thing that we see is that we allow the foot to move there. Because how many joints do we have in one foot?
More than 30.
So joints are there too?
Yeah.
To do what?
To move your foot.
So we really want to allow that movement there. Of course, we don't want to do overpronation or rolling in too much, but doing the complete opposite also can lead to some challenges sometimes. Yeah. And we don't want that. We want natural movement in the foot because we have so many joints there. So that's all we did. And we see a limit there of 19 centimeters. And normally we try to aim for something around a minimum of 11 centimeters. If it's 11 or less, we try to improve that. But it has to be sort of similar. So we're going to test the other side as well. You can go for it. Aha, you have to go a little bit closer here.
Yeah.
Good, is this about the maximum?
Yeah, I think so.
Good, so we see a big difference there. And this can happen sometimes, maybe after an injury coming back. Or it just happens and no one really knows why. But this is an important thing to improve. The maximum difference we can have there is about 2 centimeters. So we have to work on that. Well, what shall we do? We don't know yet.
No, we don't know yet.
So we have to figure out where that limitation is. And for that we use you, because I want to know, if you do that, if you do your maximum plié, where do you feel it?
I feel it in the back of my foot.
Of your foot?
Yes.
Okay, can you point to that for me?
Like.
Okay, good. So she feels it right in the back.
Yeah.
And does it feel more like a stretching sensation?
Yeah.
Good. Then for us that's a sign that we can safely stretch that. That's the next thing we're going to show now. So I'm going to ask Steffi to go down in a position. You can go. Where she lets her knee go over her foot as far as possible. And she can find the direction in which she feels the biggest stretch.
Yeah.
This is important because in stretching, if you don't feel it stretch, you're probably not stretching.
Yeah.
Good, you found it?
Yeah.
So you sort of relax into that position for a bit, and I'm going to ask you to add something active. I want you to push your forefoot into the floor, And this can be with quite a bit of force, but you sort of build that up. You hold it there for about 10 seconds. Then you relax into it, go even deeper, and then you try to flex your foot for another 10 seconds. And relax and you go even deeper. This, back and forth, you can repeat about 4 times. Then we have a good 80 seconds, 90 seconds of stretching. And that time under tension is what we need. And it's also something we have to do regularly. So how many times a week do you think you should stretch to really improve?
Probably like 5 times a week.
At least 5 times a week. Of course, in that whole process, if you feel any discomforts, if it's too much, is there other types of reactions that you're not sure of, don't force it. Good, so we know what to do when there's a stretch right in the back. If the stretch is a little bit more on the inside, so on the big toe side, we can do the same thing, but lift the big toe up. And maybe we can put something under the big toe, so we try to bias stretching the muscle Flexor Hallucis Longus. If you feel it more on the outside, we have to find a board that makes your foot a little bit more diagonal, so the outside is a bit longer. And the peroneal tendons get a bit more of a stretch. However, there's another place where you might feel it.
Yeah.
Some people feel the limitation is not in the back at all, but
In the front.
right in the front, sort of like a blocking sensation. And that's something we cannot really stretch. For that we have to do something different.
Yeah.
So for the purpose of today, we take an elastic and we put it on the back of the tibia and the fibula, the 2 bones of the lower leg. And it can be maybe even a little bit lower. Yeah, good. Then you can go down in the same position, except we stay a little bit back. And then we're going to rock forward and backwards without forcing the joint, but allowing the joint to glide and slide a little bit better, motivating different movement in the joints there. This can be the joint between the talus and the 2 lower leg bones, but it can also be the joint between the 2 lower leg bones. We repeat this 40 to 60 times, and the same thing counts. You want to do this regularly, but you're not pushing through that closed angle discomfort that's there. That blocking is not something you can stretch through. Good. So far, any questions from your side?
No.
I hope we've been clear so far. So we looked at range of motion in plié. We figured out that there is a way to test that.
Yeah.
Then we look at what you, as an individual, what you feel, where for you the limitation is, because that makes a difference. Stretching for you is different than for someone else. And that's always important to really listen to what you exactly feel. And like I said, if you don't feel it stretching, you're probably not stretching. And we showed you a few options to see if you can get a bit more range out of there. Thank you very much for watching.
Thank you.
Thank you, Steffi.
Thank you so much.
See you next time.